All right, future nurse, let's dive into client positioning, which is very important for the NCLEX. Let's talk about Fowler's position. So Fowler's is essentially when a patient is on their back, but they're not flat on their back because that's supine. Instead, the head of the bed, or HOB, is slightly elevated. Now let's break down Fowler's into 3 categories. We'll start at the top with semi-Fowler's, which is when the head of the bed is raised 30 to 45 degrees. A clinical scenario which you may see this position is if a patient has an increased intracranial pressure. Next, we go to Fowler's, which is a little bit higher than semi. We have a head of the bed of 45 to 60 degrees, and you may see an individual with an NG tube feeding be in this client position. And lastly, we have high Fowler's, which is when the head of the bed is 60 to 90 degrees. Typically, if an individual is in some sort of respiratory distress, we want them in high Fowler's, for this allows us to expand the lungs better and put less pressure on the diaphragm. All right, future nurse, I hope you learned something today. Please follow for more tips and tricks on commonly tested topics for NCLEX, as well as sample questions that I post on my page.